Well, I'm here at the Starlight Neonatal Unit, and I'm standing by little Josh, who was born at 26 weeks. He's here with his mother, Caroline, and we're going to meet Su Laurent, who's actually the consultant here in charge of the neonatal unit. Sue, do tell us all about your team. Let's introduce them.
Hello, you caught us actually in the middle of a ward round, so let me just show you an example of what goes on. On my right, I've got Zaf here. Do you want to say what you do, Zaf?
I'm one of the junior doctors here. I'm basically function as a part of a team, as Sue has mentioned. And we see all the babies and basically do everything that's required for them. And then as a team, we include everybody in terms of managing the baby at different levels. So at the end of the day, we have a full quality of care for each one of the babies. It's kind of personalised.
Thank you, Zaf.
Thank you.
Over here's Christina. She's a registrar, which means she's a bit more of a senior doctor. She's in charge of all this gaggle of doctors over here. Tell us what you do, Christina.
Like Sue said, I'm in charge. I look after all these doctors, I supervise them, and I'm being supervised by Sylvia here, who's my associate specialist, and my consultant, Su Laurent. And my daily task is to be involved with the management of each individual patient. Yeah.
Lovely. Thank you very much.
Who else, Sue?
Well, perhaps you want to go over to Sylvia here, because we're going to the more senior ones now. Tell us what you do, Sylvia.
Hello, hi, I'm Sylvia. I'm the associate specialist. I supervise the supervisor. Yeah, and we do the ward round together and discuss what we need to do for the babies. Make them better, make them grow.
It's a good team here, isn't
Yes,
it?
yes, it's very enjoyable to work here as a team.
And you're not all here. Sue, let's wander down the ward, shall
Come
we?
down and see the more intensive care part of the department. Over here, we'll find Angela. She's one of the senior neonatal nurses here. Angela, what do you do?
I work in the unit in the intensive care and in the special care. Just generally nursing the babies, helping the mums to learn how to do things.
And who have you got with you at the moment?
This is Gina, and this is Gina's mummy. She's just coming in. She's going to do her napping.
Born a week here today?
This is from 25 to 12.
Wow.
It's bizarre how I just arrived exactly at the same time.
So we're celebrating her 1 week birthday.
Yes, to Gina. And if we come over here, we'll see Dr. Tim Wickham, another of the consultants on the unit who works with me, and he is doing a neonatal cranial ultrasound. The idea of the ultrasound is to have a look inside the baby's head in a non-invasive way to see what's going on. Tim, what are you doing at the moment?
I'm having a look at the baby's brain, basically. Babies have a little soft spot on their head, so you can actually, there's a little window you can look through the bone, and you can actually look at the brain, so you can get some pictures of how the brain looks, and it's quite useful for us to see if there's any evidence of any damage or any bleeding, and then monitor that and keep an eye on it if there is any as time goes along. And all our babies get head scans. As you can see, it's a very straightforward, easy thing to do. It's not painful for the babies, and it gives us some information. So all our babies get head scans, and the sicker ones get them a bit more often.
What about all the beeping? Does that disturb the babies?
Probably, yes. And there is quite a lot of discussion around the environment that babies are subjected to, and noise is one of those things. And these incubators don't provide much protection from noise, and there are discussions around whether babies should have little earmuffs to reduce the amount of noise, because there is quite a lot of noise that goes on, and loud beeping noises and things. But we try to minimise it in that not knocking into the incubators, and we often put drapes over the incubators to keep it nice and dark and as quiet as possible.
And how many babies do you have here on the unit at any one time?
This is a hot room, so this is what we call the hot rooms. This is the intensive care room, and we can have, well, at the moment we've got 4. We can have probably not much more space for 6 or 7 at most. Usually about 3 or 4. These are where the sicker babies are, the smaller babies. So these are ones that need the most sort of ongoing care minute to minute. So there's only so many of those that we can deal with at any one time.
Well, let's speak to Sue again. Thank you very much, Tim.
Okay.
Your team is obviously a very cohesive unit and has to be here.
Yes.
How well do you work as a team?
I think we work very well. That's the key to the whole way the unit functions. We work, the nurses and the doctors and all the rest of the staff, which includes our receptionist, for example. Without her, there'd be nobody to organise us, nobody to answer the phone, nobody to be there for the parents. Perhaps we should go and say hello to Maureen as well.
Let's do that.
And here is Maureen, the hub of the unit. Without Maureen, we wouldn't know how we could organise ourselves. Maureen, you're on the phone at the moment.
Sorry.
That's all right. That's what it's all about.
So how many people are here on the unit at any one time on a shift?
Any one time we'll have 3 junior doctors. We'll have at least 6 nurses. I think, roughly 6 nurses. We'll have Maureen. We'll have a number of other members of staff. We'll have people coming up and doing x-rays. We'll have people, porters, collecting blood samples from us. I mean, there's a lot of activity going on in a unit like this.
And with a unit like this, you've got a lot of emergency calls, so presumably the consultants are always on. You know, you've got a shift pattern with you're on call.
The consultants, yes. And in fact, our shifts tend to sort of run over. That we work during the day and then we're on call at night as well. But hopefully, a lot of that time on call is at home. But obviously, on a unit like this, we get called in a fair amount.
And the phone's going already.
The phone's going already, and that's somebody wanting to be let in.